So let's talk housing first. The You should be looking at a slide now of goals of Housing First forums and what we're trying to do here. So I think put very simply, my goal in this work, and I think the agency's goal in this work, is to increase awareness of what works. So what actually, when we look at the science of the work that we do, what seems to be most effective and works, and how do we increase that awareness through these forums? And then how do we work together? Through these forums, how do we create a collaborative space, and how does that grow into other collaborative spaces in which we can work together and harness that resource of collaboration to really make a significant reduction in homelessness in our community. So, future Housing First forums. I want to mention that the future Housing First forums our next two will be about encampments and about outreach. And so you can sign up for those forums at helptucson.org. And I'm really looking forward to the presenters to talk about it, encampments and outreach, because that's, a continual challenge that we're having in the community. And there's really some effective ways of dealing with that I think these folks can bring to the table. So today's agenda, first of all, overview of what we're doing in Housing First in our community, sort of the next steps to how we bring Housing First to scale. How do we get this really across our community even more than it already is? And then, as I mentioned earlier, Jasmine's kind enough to be here to talk about her experience with the programs and services that we're talking about. So mission statement, just to mention that our mission is to end homelessness, and we know that we can do this through providing evidence-based practices and services that will reduce homelessness and solve homelessness in our community. Sometimes people will ask me, what's the one thing, if you could have people take away from any presentation or any conversation around homelessness, is that homelessness is a solvable problem. Often we've come to the conclusion that over the years that this is normal to have unsheltered homelessness in our community at this level, and that's just not true. There was a time when we didn't have these levels of homelessness in the United States, and there can be a time when we don't in the future. So the other one is our vision, and so at OPCS, we envision a world where homelessness is rare and brief. So we recognize that people may become homeless, but when they do, we want systems and services in the community to swoop in quickly and be able to resolve those issues and concerns. I want to talk just briefly about diversity. So, and I'm going to read our diversity statement, which I add to all of our presentations. OPCS is intentionally working towards a culture of inclusion, diversity, equity, and access. So for us, we use this acronym IDEA. We acknowledge that forms of systemic racism, sexism, homophobia, transphobia, classism, poverty, ableism, and anti-immigrant sentiment has marginalized persons in our community and negatively impacted their access to housing, employment, and healthcare. Because of this, we aspire to greater inclusion and access throughout our organization, including those in need of housing and services, as well as our staff, board of directors, and volunteers. We want to make it very clear that we oppose discrimination and racism by working to remove stereotypes and negative attitudes that affect all our interactions and stand in the way of our vision of ending homelessness in Pima County. So who are we and what do we do? So OPCS, it has a continuum of services. So when we talk about OPCS, which I had someone recently say, who's OPCS? Well, we used to be called Old Pueblo Community Services. And we changed our doing business as to OPCS. And so OPCS since 1996 has been providing transitional housing, case management, and support services, starting with people in reentry. And we have now, over the years, grown to a full continuum of housing and services. So you can really see this wide range from outreach all the way to permanent housing to all the services that come in between. We do not provide physical health care, and we do not provide psychiatric care, but get both of those through our partner agencies in the community. So let's talk about housing first and what is housing first. I think that the best way to talk about housing first is to talk about Sam Simbaris. So Dr. Sam Simbaris, met him many years ago. Housing First started in the 1990s, and he was working with people that were homeless as a psychologist. And he was trying to help people who were living in the streets. And he had a team of outreach workers and behavioral health professionals, and they were out there on the streets every day working with people. And at the end of a year, he looked at their work and said, you know what, we've been at this a long time, and I must admit, it doesn't appear that anyone's getting better. We are managing certain crises and problems, but they don't seem to be getting better. And we've seemed to have tried everything that I and the team could come up with to figure this out. So he decided he would do a wild idea, especially in the 1990s, to say, what if we went out and talked, instead of trying to help people today, what if we went out in the next week and talked to people who were living on the street and said, what is it you need to improve your wellness? Whatever we're doing isn't quite working, so what could it be? And what happened was people said, oh, isn't it obvious? I need a safe place to live. I need housing. And they all went back to their office and looked at each other and said, why didn't we think of that? The solution to homelessness might be housing. What a bold idea, right? So we needed something that would help people get into housing. And when they started this work, they found there were all kinds of barriers. And so they developed the Housing First program to rapidly get people into housing to improve their health and turn housing into an intervention, not a reward or a benefit at the end of some behavioral change or requirements. This was a simple but radical idea. And it's from this initial experiment that Housing First was born. I have put on this slide the pathwayshousingfirst.org if you want to learn more about the origins of Housing First, if you want to get into the research behind Housing First. If you go to that website, if you want news, information, you can get that all there. OPCS employs Housing First, and we have developed ways of implementing Housing First that we think are effective, but we did not invent Housing First. We deliver programs and services that have already been demonstrated to be effective in a large scale. So this is one. So OPCS is a Housing First agency. So I want to talk about that for just a quick minute. So there are 5 principles that support Housing First, and these principles are across all of the services and all of the housing. And the number one that I want to highlight is this immediate housing without preconditions. So what does this mean, immediate housing without preconditions? Well, what it means is that some requirements are not equal across systems. So there are conditions for someone to be a tenant in an apartment and to have a lease. What we're saying is that they should have the same requirements as any other person would to be a tenant. So you have to abide by the lease. You have to be a good neighbor. You have to be, if you were to come into our low barrier shelters, you have to be a good neighbor to other people in the shelter. You can't be in immediate danger of violence or threat to staff or other people. But we're not going to put in rules and regulations that you would not require of anyone else who was using an emergency shelter. So these rules and regulations have purpose. There are also not rules and regulations that are arbitrary or simply there to serve the comfort of the organization, but are rather there for purpose and meaning. The others that are critical to this that build off of this immediate housing is this idea of autonomy. So choice. People have client choice and they have personal goals for their life. And humans often react poorly when you try and control them. Used to do activities and exercises as therapists where you'd have people put their hands up and push against someone else's hand. And the human reaction to when they're pushed is to basically push back. So it doesn't make much sense to try and push people into change when they know that they have choices and options. it's better to allow them to experience those choices and options and to work towards those goals in a way that they understand and they prefer. The other one is recovery focused. So to do housing first, we have to recognize that persons can recover and live within the community. We are not very good judge of who will be successful and who won't. So persons can recover, and oftentimes they might be people in conditions and situations that we don't think they can recover, but we have to give that chance and that opportunity for recovery, and people will continually, I have found, surprise you. Um, the other part then is this individualized support plan. So if you're giving people choice and it's recovery focused, then the work we're doing with them should be work that's meaningful to them, work that makes sense to them, that fits their particular goals. People have different employment goals. People have different housing goals. They have different family and personal and relationship goals. Our services should support that, not change that. And then the other one is this social and community integration. So we know, I mean, a very simple statement would be segregation is bad. Every time we've seen segregation in communities, it's not a healthy part of our community. So persons who have been experiencing homelessness should be able to live and be tenants and be employees and be patients just as anyone else would in the community. Oftentimes we think about specialization, and so we'll might say, gee, we need a doctor who serves homeless people. Well, really, homeless people need a doctor. They don't necessarily need a doctor who serves homeless people. Uh, it's always better for us to live together in the community amongst each other, and it's always better to have a diverse community instead of this segregation that happens sometimes. So that's housing first and kind of the high level core principles. Um, I want to talk a little bit about how housing first differs in sort of a paradigm shift. So safe, affordable housing and housing first is not a reward for good behavior. It is the core intervention that helps change people's lives. So what does that look like? So in a traditional model in shelter for a very long time, and still in some of our shelters out there and some of our housing programs, the expectation is the person who comes in will first get recovery. They'll get full recovery from all their conditions. So they'll be abstinent and not be using any substances. They will cure their addictions. They will cure their mental health conditions. They will cure their employment concerns. And they'll do that. And then at the end of that, they will get housing, sort of as a reward at the end of the tunnel. It seems to make sense, but in reality, that's not the way it works. So housing first recognizes it kind of flips that on its head and says housing is the pathway to recovery. Recovery isn't the pathway to housing. Housing is the pathway to recovery. All of us on this webinar today, if we were to lose our home and our family and our jobs, and we were destabilized, we would, and if someone came up to us and said, Tom, I want you to work on your interpersonal issues. I would say, no, I need to be safe tonight. That's my focus. I need to find a way that I can be safe and cared for tonight so I'm not in harm's way. And so unless we address that primary foundational condition, it makes it really hard to work on recovery. Now, another way to look at this is to look at it from systems approaches and to look at it from client base. So we will do both of those. The other thing I want to mention is that although this is a simple concept, you look at this slide and you go, oh, that's pretty straightforward. It's a humongous paradigm shift that changes the entire helper workforce and systems from this recovery first, then housing versus housing as a pathway to recovery. So although it's simple and it's pretty straightforward, and it's really nice that the name of the model is what the model does, housing first, it's also creates massive change within systems that can take time and take lots of resources to make happen. So Now, having said all that, another way to look at it is from the experience. So this is a group of clients we had in a Pima County Housing First program years ago. And this family basically came in out of a jail situation and basically needed some place to stay. And once they were able to move into one of our apartments and had a place where they could be home, then that allowed them to focus on their recovery and the personal goals, such as education and reuniting with their children. People oftentimes in these systems, when they were recovery first, were stuck in this catch-22. I can't get into a job because I don't have an address, and I can't get an address because I don't have a job. So it becomes a cyclical, I just can't move out of this situation. Housing is the first key to move out of this situation. So why housing first? A short answer to that would be it works best for most people. You will find people who moving into housing rapidly is not either what they want or works well, but that is a small minority of folks. So there's a need for different approaches. But when we're talking about making change in a community and a large scale public health, we want to put a lot of effort and energy behind what works best for most people, because that's what most people are going to need. So that's when it comes down to why does OPCS do housing first? It's because we recognize the evidence. It doesn't have to do with our beliefs. It has to do with the fact that we recognize the evidence that that is the approach that works best for most people. So how do we recognize that? Well, I won't go into a ton of detail, but number one is national and international outcomes have demonstrated that. So when you look at this, happens to be studies that were done early in the Housing First programs from 2009 to 2014, you'll see that it's the only housing intervention service program that has been demonstrated to be effective in large randomized clinical trials. So this is like the gold standard, right, for research, randomized clinical trials. So the evaluator or researcher doesn't know necessarily which group a person's in. You've got this kind of blind aspect to it, and it's large and a large number of people, and it's over a period of time. So it's you could kind of demonstrate anything could work once or twice. What do they say? A broken clock is tells the time correctly twice a day. So this is about how over time and over large numbers of people does this actually show improvement. So you can see this is over 2,000 households at 5 different sites. This has been also demonstrated in the US through studies that were commissioned through the VA, through HUD. This is a standardized model for housing and recovery from homelessness. When we look at it at a local level, I kind of like to bring out this one. There's a number of studies that we've had the pleasure of working with Arizona State University, with collaborating with the U of A, with Rand Corporation in some studies and evaluation to really get third-party researchers to say, how are we doing to evaluate our progress of our programs. This is our first housing program. And so this is our first Housing First program, I should say, which was at a small property of ours, and we had no idea for sure how it would turn out. The evidence said it should work, but we didn't know for sure. So what you'll find is that we saw typically in that time that about 21% of people in traditional shelter programs, so that recovery first model, moved into permanent housing. However, and about 44% did not return to homelessness, which seemed pretty good, I think, to some folks. But then when you look at the low demand shelter, as we stood that up in the first year, we saw that 69% of the folks that we were serving moved into permanent housing, and about 75% did not return to homelessness. So one of the ways to look at this would be if 100 people walked in the door of these two different models, you would see in a typical emergency shelter, you would see about 21 of them going into permanent housing and about 12 staying in permanent housing. Whereas a low barrier shelter model with Housing First, you would see 69 people move into permanent housing and 52 people remain. So the number of people that you're able to help get into permanent housing and stay in permanent housing grows exponentially when you do the Housing First program. This does two things. One, it reduces suffering for the people that are experiencing this problem. It's more effective, and it is more cost effective because both of these models have a similar expense. And if you're spending money and it's not getting the result, people are cycling in and out of homelessness, and you're spending this money again and again. All right, so that's about that. Now, don't want to go too far into that because you can do a whole 2-hour presentation on Housing First and the research, and that is a different day because we're not going to do 2 hours, right? Um, I want to mention Housing First is a systemic solution in Pima County. So Housing First is not, you can implement Housing First as a program, but it's much better if you implement it across the system so that you can say, okay, this Housing First system is working together. You're going to get much more bang for your buck, and you're going to help and reduce much more suffering. So let's talk about that briefly. If we look at the traditional model that I initially mentioned, it seems as if it's this linear sort of model, right? People are unsheltered, they go into this traditional shelter, then they go into transitional housing, and then they go into rental assistance. And they really get this medical, vocational, behavioral health, all of that is happening typically in transitional housing. So really stability then is required before you move into the permanent housing. Now, as I mentioned earlier, one of the challenges with that is that folks with high needs are often not served within that model. So the people who need it most are the folks that have the hardest time getting in and succeeding in this model. So you'll see these high need folks in the unsheltered group are often not touched because they're not able to get themselves to the shelter or get themselves to the office where it has the traditional services. Or while they're in those traditional services, those services are not designed, and that housing is not designed for folks who are in a continuum of wellness and experiencing setbacks and difficulties with their own mental health and addictions. So they end up getting pushed out of that high barrier shelter and transitional housing and never make it to rental assistance. So we spend a lot of money. We don't necessarily serve the people we want to serve, and it ends up not resulting in many people actually moving into housing. So what would it look like for a housing first system? So in a housing first system, which exists in Tucson right now, is one that would have outreach, reach out into those people who have high needs. So you'll see in this model, outreach reaches all the way over to those high needs folks. So that's outreach workers that are going out to the washes and places to find people who have chronic health conditions, are older adults who have chronic addictions and can't get into or out of the encampment or shelter they're in. So we go to them and identify and find them. And then those folks move into what's called low barrier shelter if that's warranted. And in that low barrier shelter, there are rules and regulations, but they can bring their pets, they can stay with their partners, they can bring their belongings and store them. They can be somewhere along the continuum of wellness and recovery. So it's not like they have to be fully recovered. And then we can move into rental assistance. And you'll notice people can go back and forth in this system. So they may go into rental assistance, they may end up having problems with their lease, and they may move back into shelter and then move back into rental assistance again. So it's a very dynamic model. Um, there's a whole list on this slide, which you can then pull down later and look at. But the city of Tucson has a Housing First program, which pulls together their outreach teams between the city and OPCS, organizations like Community Bridges. There's housing navigation. So all these folks are working together. Pima County Eviction Prevention Program, which is reducing the entry into homelessness. The state of Arizona, which has been giving housing trust funds for low barrier shelters to be stood up in communities, federal government with VA and HUD housing, and a really interesting new program that's being funded by Quick Trip QT, which is about outreach and support within their ecosystem where their stores are and where people are in need. One of the myths I want to address with this is this idea that housing first approach enables participants to do whatever they want without consequences. That's probably one of the biggest questions about housing first is, well, can people do anything? The answer is no. There are requirements, there are needs, expectations that people have to have when it comes to housing first. So it's not this idea that it's a free for all. People have to have rules in their as tenants. They have to follow leases. They have to not be a danger to other people. So there are rules. They're just not arbitrary rules that are designed to control people with very limited purpose. To get a sense of that with our agency, I've often had people say, Tom, do you guys ever think of doing services with your Housing First model? The Housing First model is a rich program model. We provide, and so do other agencies do Housing First, a wide range of services as you see in this slide, from housing assessments to 24,000 hours of support services so far in 2024, and it moves a whole bunch of people into permanent housing. So I want to just briefly mention this whole notion of does housing first work or not in Pima County? And I think there's two potential questions. One is homelessness reducing? And two are people returning to homelessness? It's really important for me to mention that homelessness is a complex, community-wide health problem. And it's hard. You can find one piece of evidence here and one piece of evidence there, but it's hard to judge a whole system based on one piece or another piece. So you really are trying to we're trying to see trends and change over a period of time to indicate whether we're being successful. Because they say you can make a chart say anything. If you look at short periods of time or one program or another, you might show a certain outcome, but it isn't consistent. We're looking at that consistent over time. So let's take a look at that. I think the most telling indicator of whether or not this Housing First program through the city of Tucson, OPCS, Pima County is effective is the number of people who are homeless. You'll see that unsheltered homelessness or overall homelessness has decreased a little bit in Pima County. It was on quite the rise for a while there. That's good news, but it's hard to say what this small reduction at this time means. But you will see the area I've put in kind of the red circle there, that the people on this orange line are folks that are unsheltered in our community. And we are, for the first time in the last few years, seeing unsheltered homelessness decrease. And we're seeing sheltered folks, so people who are in emergency shelter and transitional housing and things like that, increasing. So what I think this means, and we'll see what next year's count or this year's count looks like, is that more people who are in unsheltered conditions that weren't able to get into shelter are able to get into our low barrier shelters. And if we continue on this path, might see an continued decrease in unsheltered homelessness through this employment of low barrier shelters. I know we intend to be opening with the city of Tucson this year over 100 beds of new low barrier shelter. So great opportunities there. The other one that I'll just mention this briefly, and that is that when you go into HUD's numbers, you can see that 81% of the folks who go into permanent housing in our current system and model in Pima County remain out of homelessness at 24 months. I think a lot of people think that success rate's much lower. It's actually quite successful, and people do very well in permanent housing. The last thing I'll mention is this sort of next steps. So what should we be doing? And this will be the conversation throughout the year. So I won't put a ton of effort into this at the moment, but essentially we need more compassionate low barrier shelter. We need more harm reduction in encampments. People can't get well if they're overdosing, if they are in the emergency room. We need to help people stay well through harm reduction techniques so that they can get into shelter over time and do well. The other one is shallow subsidies. So that's helping people with their rent in small amounts that could reduce people from ending into homelessness. And then more affordable multifamily housing. Pima County, I'm grateful to be on the commission for affordable housing in Pima County, and they have many programs and services. So does the city of Tucson to increase the construction and expansion of affordable housing. The other thing I'll mention briefly is this idea of collaboration and leadership. We have to find a way to work together. So that means leadership within agencies, within government, within business need to work together. And we need workforce development. We need to be able to integrate community training. We need to plan for a new workforce throughout nonprofit agencies and the government, and we need to be consistent and accurate in what we deliver. I want to mention in my last slide here, the community collaboration opportunities. So we were thrilled and still are thrilled to have opened the first Center for Housing First in Pima County. And part of that is two phases. One is our service center, which opened already. And now in February, we'll be opening our collaborative space. So that's a 10,000 square foot building. You can participate in training and support services there in the future. We'll have a collaborative space for other nonprofits. This is designed to coordinate and collaborate across the system. So I won't do questions now because I know that Jasmine is going to talk some about her experience, and then we'll open it up for questions. I also know that sometimes these things get a little close to the edge time-wise. So if we go over with any questions, I can stay on, and I'm more than happy to stay on for a bit afterwards to answer questions. So I appreciate that. I can be a little long-winded, I've heard. Jasmine, I pass it on to you.
Hi, I'm Jasmine, and um, OPCS has helped me. They've given me housing. Um, Before they started helping me, I was in rehab for 6 months, and prior to that, I was incarcerated for 2 years. So coming out, I didn't have stable housing. I didn't know where I was going to go because my housing before that was really unstable. I lived with my family and they were constantly calling the cops on me. So that led to me being incarcerated. And at the time, I was severely addicted to drugs. And having permanent housing now has really helped me. I've gotten my daughter back. Um, we both have a nice house. We're both very happy. We're very stable. I'm also bipolar, so it helps me very much to have a stable environment where it's not a bunch of chaos. And I've been on probation successfully for the past year. My case manager helped me a lot. She went to court with me and talked on my behalf how I've improved a lot since I have been on her caseload. And yeah, OPCS has helped me a lot. Thank you.
All right. Thank you very much. I really appreciate that. It's good to hear. And this is the second time we've met through this process. I don't know, Victor, if you have any particular questions or anything for either of us. You're muted. The mute button got you.
Unmute. What is the average time an unsheltered person has to wait for a shelter bed? And what is the average time from a shelter bed into transitional housing?
So I can certainly answer that. Thank you. So the average time an unsheltered person has to wait for a shelter bed is a hard question for me to answer. And the reason it's hard to give a certain number is that we don't operate off a wait list model. So because we're trying to serve, we're more like an emergency room. So figure everyone kind of comes in, we do housing assessments on them, and then it really depends on how high a need someone has. So someone today may have, it isn't a first come, first serve. You don't end up on a waiting list. Things keep moving, just like they would if you went into an emergency room and someone came in after you. An hour after you're there, someone comes in with a bigger crisis. They'll serve them before they serve you. It's not like there's a queue. So, so it's really a dynamic list, and it makes it kind of challenging to see exactly how long it takes. I will say this, if we're serving someone and they're out in the community and they're that high need person, we've had, for example, someone who was in an encampment who had been sexually assaulted the night before. Other people in the encampment told us, and we learned of that, are outreach people who are integrated, I should say, with El Rio Healthcare with street medicine. saw this individual, and then moved them into shelter that day. So you could meet our outreach worker that morning and you could be eating dinner at the shelter. It's not like there's a certain wait list. The other one was time it takes to go from
Shelter to transitional housing.
shelter to transitional housing. So our folks don't often go to transitional housing. Persons can go directly from, we might work with people who are on the streets that for whatever reason, either they can't get into a shelter because they're not high on that priority list, or they choose not to. They would prefer to stay in their encampment. They can go from the encampment or the streets directly into permanent housing. And they will usually go from shelter directly into permanent housing. So we don't have a lot of transitional housing. Our transitional housing is primarily for folks who are coming out of incarceration and need a bridge and a certain amount of services that are required by the authority that's released them from incarceration. So that's really, and there's intensive outpatient treatment services in that, but the average person doesn't go to that. Now, having said that, the people can stay as long as they need to stay. So they leave when it makes sense to leave. So some people might be with us 9 months. Some people might be with us 30 days. The average is more between around 45 days that people are with us before they move on to the next kind of level. So it just, but there's an incredibly wide range. So that average might not mean as much.
So Gary Becker says, fabulous overview, Tom. Glad I attended, really needed it. And he also has a question for Jasmine. Thanks for sharing your experience. How early in the process with OPCS were you assigned a case manager?
I was assigned a case manager within the first meeting. So I got out of jail and I was in rehab for 4 months. And then I got assigned a case manager with OPCS.
Thank you. Mark asks, is OPCS focusing on free housing first solutions or low income housing solutions?
Mark, I think, and you can, put in your question here if this is what you mean. If you mean by free housing first or low income, most of the people that we serve, a vast majority, when they move into their housing have zero income or extremely little. So typically, all of the voucher is being paid for through rental assistance or through the the public housing authority's voucher. So, and then, they work towards gaining income. So they don't have to have income when they move in, if that's what you mean by that. They could be low income, but we're really focusing on those who have extreme low income and are unsheltered. There are a lot of other programs that are low income, workforce housing, things like that. So hopefully hopefully I've answered that question. Oh, that I was able to figure it out. That's not common. So thank you.
Did you see Mark's reply?
I did. Yes.
Okay.
Uh,
All right. Does anybody else have any questions? We have 15 more minutes. Jasmine, what or who connected you with OPCS initially?
I've signed up for SPDAT, which is a housing thing too, and they connected me. It was La Frontera that I signed up my SPDAT, and then OPCS called me.
So for those of you who don't know what the SPDAT is, it's a basically like a questionnaire, a housing assessment that assesses people's vulnerability to rank them into how fast they need to get into housing. So Jasmine, when you went to La Frontera and had the assessment, how long after that did you get connected with us?
It was about 2 months.
Okay. So here's another question from Charlie. I have a 4-bedroom. I should read it first. I think, Charlie, I'll answer you that offline. That was a question about a house he owns possibly being used for affordable housing. Yeah, so the VI SPDAT is Vulnerability Index Dash Service Prioritization Decision Assistance Tool. Thank you for the reminder, Raul. Mark has another question. Does OPCS have additional housing capacity in the planning stages? How many quote unquote homes does OPCS think they can provide in the near to medium term, optimistically?
It's a great question. So, we can, depending on what the market will bear. So the housing that we use, as I mentioned earlier, is integrated into the community. So when we get a voucher, it's what's in some form or another a housing choice type voucher. So the person who is getting the assistance, that rental assistance, can choose where they want to live, and we help them through our relationships with property owners. So we don't really own very much property, but rather have people all throughout the community in their own apartments with various different market-based apartment rentals. Now, having said that, I think it's about a combination of the funding and a combination of vacancy within multifamily housing. So most people are going into a rental situation, into apartments. Most of the people we serve are either a couple or are individuals. And so it's really about one bedroom and studio apartments that we're looking for. And there's only so many of those in the community. So, you know, there's a real effort through Pima County and the city of Tucson to sort of figure out how many units are needed and how much we can stand up in a period of time, because a big part of it is just going to be having more multifamily affordable housing and having more multifamily, or not multifamily, but single family housing, so that people who are in multifamily housing, who get that job, who are successful, who are doing well, can get their dream of home ownership. And that opens up units for folks who are first moving into multifamily housing. So there's a lot of different factors. Right now, we have over, at any given time, over 500 of these households, primarily individuals, who are in apartments around the community. We are looking into a really interesting task force right now, that we've developed a task force that's looking into affordable housing, where we put a shallow subsidy on top of the current rental assistance. What this will do is, for older adults who are living in places where it's not safe, they and doesn't have good access to healthcare services, we can help them move into market-based apartments where they can, one, be more safe, and it has more opportunity. They're often called areas of opportunity. So it creates a longer life for them and more opportunity and wellness. The other thing is with families. So we have families who are with children who are in areas in which there's lots of stress, danger, violence, things like that. And we want to be able to give that extra money so that they can then move into an apartment also in a higher opportunity area. And what most research shows is that if you do that, that really changes the trajectory of poverty for the child in that next generation. So there are efforts like that we're also doing, where we're trying to do that. And we're shopping around and looking for donors and support for that. We've applied for some city funding, and we'll be talking to foundations and others. You can impact a lot of people, prevent a lot of homelessness, but it's a little outside of the system. So a lot of nonprofits might, in a typical model, purchase apartment complexes, and we are doing some of that. But really, when you talk about the, thousands of people are homeless, we'll never be able to purchase enough apartments as an organization. So we don't want people to be segregated in OPCS apartments. So what we try to do is work within the current system and encourage more affordable housing development by others, so that we then have access to that. It doesn't tie up all of our resources in real estate, and it allows us to put more of those resources to serving folks and providing services and those extra pieces. But really, it's about, how do we get outside the box and work together. And that came from a collaboration of folks in the community. You'll find this opportunity areas in that if you ever get into the Pima County has a Pima County Prospers or Prosperity Plan. If you look that up online, you'll find this wonderful, wonderful document that gives you tons of information about what they're doing to try and improve that. But it's all these pieces working together. I mean, if I had two messages, it would be that you can end chronic homelessness. This is a solvable problem, but you've got to do what works and you got to work together. OPCS can't do this by ourselves. I don't think any other nonprofits or government can do it by themselves. We have to work together. So,
I have a question. We have about 7 or 8 minutes left. We briefly mentioned about Jasmine having a case manager. Could you talk for a minute about the permanent supportive housing program of which she is a part?
oh, of course, yeah. So as soon as someone is assigned, and we don't provide shelters or housing in which people line up and queue in a neighborhood, they get referred. So either our outreach worker who's connected to our shelters says, we need to get this person in because of how they score on the assessment, or another agency says they've scored on this assessment, they're at the top, we need to, this person is someone you can serve. So then when we get that referral, they're immediately assigned to a case manager, and they come into the organization, they do an assessment and a screening to make sure that they're happy with us and we're a good fit and we're the best person to provide them help and support. And then that case manager goes into navigation mode and is there to help them meet their immediate needs of navigating into permanent housing. Oftentimes, it's about document discovery. So to rent a place, oftentimes people might not have their birth certificate or an identification card, or they may have a challenging rental history. So how do we get all of that together so that we can present a case to the landlord, the property owner, that they should take a chance with this person? So really, it's about how do we develop relationships with the person who's come to us for help, and how do we support and develop that relationship with property owners and managers so that we're there to support them. Jasmine mentioned something I think really important earlier, and that is she mentioned that she experiences bipolar disorder. So bipolar disorder is going to be really hard to be in a chaotic shelter type environment and such. So most of our shelter beds are actually apartments, so that we can say, okay, this person is probably going to do better in an apartment than they would in a congregate shelter. So having those options, having that back and forth is really critical. And that's really the case manager's job. And that's the one kind of requirement that goes, the thread that goes through all our programs, is that you have to work with your case manager. You can't just say, well, I want housing and I'm not going to work with anyone, right? You have to work with your case manager. I think people sometimes have this idea that in Housing First, people can just do whatever they want. Number one, they're misjudging people. People don't want to do whatever they want. They want help. And two, there are commonalities and conditions that people have. And one of them is you have to work with your case manager to move forward into permanent housing. And then after that, sky's the limit. I mean, you really, it's if you, I don't know if this was your experience, Jasmine, but we have food service, we have employment coaching. So there's all kinds of services you could get. And we're more than happy. I mean, we're not a silo. We want to connect you to services in the community. Primavera has a works program. Pima County One Stop has employment programs. Healthcare is provided by brilliant folks like El Rio. So it's really about how do we work together as a team, and not just, oh, it's got to be OPCS. We want what's in our heart. We want what's best for the community. And that's, in the end, is sooner or later to transition us out of this homeless crisis and into permanent housing. And people often say, will ask me, how many chances do you give people? As many as they need. How many chances do we give me? As many as I need, as many as we need. We're always growing and changing. The other one that they'll often ask is, when do you give up? We never give up. Why would you give up? That doesn't make any sense. We're here to be responsible in the community and help people. Giving up makes no sense at all. There are times that we have to have safety and wellness for ourselves and the people we serve, but we don't give up on people just because they they see the world differently, or they're not fully recovered from whatever conditions they're dealing with. Yeah, anyways, I could go on and on, but it's a great question.
We have one more question from Joseph. Do you expect Pima County to receive climate refugees due to those unhoused by fires in California?
I think that's a great question. I don't know the answer to that, but it's so interesting. I was thinking of that this morning. Where are people going? What's the FEMA response to this? Because it's, right, so many people. I do not have an answer to that. Yeah.
All right, we got a couple more minutes. If no one has any more questions, I think that'll wrap it up. Thank you, everybody, for attending. Thank you to our panelists, Tom and Jasmine. I will send this recording out to everybody as soon as I figure out how to do that. And stay tuned online and via email for information about the next one, which will be, I think, the 15th or 16th of February.
Great. Thank you very much, Victor, for putting this all together.
Thank you.
Thank you, Jasmine. To everyone in the call, join us. Find a way to join us. Go to helptucson.org and join us. Let's.
We have one more. Oh, no, Mark was just saying thank you. All right. Thanks, Mark. Thanks, everybody. And
Thank
hopefully
you.
we'll see you all next month.